The reason why I decided to give this presentation, I've been at Ashtabula County Medical Center now in cardiology for 9 years. And usually this subject crops up at the end of our consult, where a man will come up to me and say, hey, Doc, I got a little problem downstairs. Or they'll come in at the end of the consult and they'll say, hey, look, Doc, is my heart, is it healthy enough for sex? Or they'll come in with their wife, and at the end of the session, the wife will be giving them one of these, right? Bring it up. So I decided this to look at it as a 60-year-old man working in cardiology. So every man is a bridge, spanning the legacy he's inherited and the legacy that he passes on. This is a quote from Terrence Real. So I'm not a urologist. I'm not a sector expert. I'm a nurse practitioner in cardiology at ACMC. Over the last several years, I've given several talks on increasing health span and hopefully increasing somebody's longevity. Most people don't talk to their primary care doctors regarding sexual health. The primary care doctor is usually very busy looking at your lipids, your blood pressure, whether you have sleep apnea, and your vaccine status. They even ask about it. Sexual health plays a huge role in a person's physical health as well as their mental well-being. One of my desired outcomes of my presentations is to empower people into taking a more active role in their healthcare. So to summarize, clinicians don't ask about it, patients are too embarrassed to bring it up, and so therefore people suffer in silence. Most people think of men's sexual health as being mainly a quality of life issue. I would tend to disagree. I believe we are dealing with health span as well as lifespan issues here. Sexual health determines the quality of the relationship with one's partner. Hormonal health is essential for one's physical as well as their mental well-being. Quick little anatomy lesson. The penis is not a single organ, but rather a combination of 3 distinct organ systems: the urinary system, the reproductive system, and the sexual system. The urinary system composes of the bladder and the urethra. The reproductive system includes the prostate. And the sexual system is comprised of smooth muscle known as the corpus cavernosus. It's responsible for erections and is located above the urethra. What is the prevalence of erectile dysfunction? Conservative number is that over 30 million Americans suffer from some type of erectile dysfunction. The percentage of men with erectile dysfunction increases as we age. 40% at 40, 50% at 50, 60% of men at 60, and 70% at 70. The thought process is that age alone does not cause ED, but is more the acquisition of comorbid conditions that cause this condition. What is the etiology or pathophysiology of ED? The mnemonic that we're taught in school for the cause of erectile dysfunction is known as VENT. It stands for vascular, so the circulatory system, the endocrine system, the hormones that are involved, the neurological system, and last, trauma. We can also add in certain medications such as beta blockers and anti-androgens such as finasteride as causes for ED. Psychogenic ED is more common in younger people and people that watch a lot of porn. 2 questions to differentiate between psychogenic ED is that, are you able to get an erection enabling up for masturbation? And then, do you have morning erection? Answering yes to any one of these questions rules out pathological ED and tells you that they have psychogenic ED. And this is handled more with counseling by sexual therapists. Medications for erectile dysfunctions. Erections caused by stimulus to the parasympathetic nerves through sensory stimuli, vision, hearing, and tactile, of course. When stimulated, they secrete something called nitric oxide. Increases in nitric oxide leads to something known as cyclic phenolphthalein monophosphate, or simply just cyclic GMP. This increases the blood vessel diameter, allowing for more blood flow and in turn getting the erection. However, there's an enzyme called phosphodiesterase that breaks down cyclic GMP, causing the loss of erections. Medications such as Viagra, Cialis, and Levitra work by inhibiting phosphodiesterase, allowing for more cyclic GMP and thus maintaining the erection. Some potential side effects of these medications. There are 11 different phosphodiesterase sites in the body. Type 5 is in the penis. Type 11 is in the back. And high doses of increased doses, large doses of Cialis, like 20 milligrams, like a lot of men will complain of back pain with these doses of Cialis. Type 6 is in the eyes, and this site is mostly influenced by Viagra. So some men will take high doses of Viagra might have some visual changes, such as blue vision. There's a new medication in this class known as Avovil, which has the least cross-reactivity and the fewest amount of side effects. Unfortunately, this medication is not yet generic and quite expensive. Does anybody know the history of Viagra? It's a cute little story in the fact that Viagra was first developed as a systemic blood pressure medication. And during the trial, it showed that Viagra wasn't really very potent as far as lowering people's blood pressure. So Pfizer asked for the participants to return their samples, and they noticed that this disproportionate amount of people that did not return their samples were actually taking the Viagra. And so this led for them to send out a follow-up questionnaire as to why they didn't return the samples, which led to the blockbuster drug Viagra, and hence first a new treatment for ED. Relationship between aging and erectile dysfunction. Simply stated, use it or lose it. The main issue for the loss of erection is known as venous leak. The penis has a unique circulatory system in the fact that it has an inflow and an outflow system. And a lot of men are able to attain an erection but can't maintain it, meaning that they have a higher amount of blood leaving the penis than the amount of blood entering the penis. And so, therefore, by giving them these phosphodiesterase inhibiting medications, you actually increase an inflow while coming to outflow. Another solution for men that have this kind of problem, limiting the outflow, is a penile band. Low testosterone also causes loss of erections. The penis has a lot of what we call testosterone binding sites, and the penis is very sensitive to testosterone. So generally, a man needs a testosterone level of at least 200 to maintain an erection. Testosterone also maintains the musculature of the penis, allowing for less blood to leave the penis during the erection. Some dosing strategies to consider, and some dosing strategies that have been pretty successful in treating my patients. In order to keep penile tissue healthy, regular erections, nocturnal erections, and sexual activity is very essential. Multiple studies showing that daily use of phosphodiesterase inhibitors can maintain healthy penile tissue. Taking Viagra only acts as a band-aid. When I first started in practice, when patients would come, I was very happy to write them a script of 100 milligrams of Viagra and let it go at that. But then when I came to think about it, was that, just by giving them that 100 milligrams of Viagra as an as-needed basis, I was really only putting a Band-Aid on that problem, not really treating what was the underlying problem. So I started using low-dose Cialis, and the benefit of using low-dose Cialis is by giving somebody 5 milligrams of Cialis, it compounds, and so it's like giving 8 milligrams on a daily basis. And so Cialis has also been approved for the treatment of BPH, So a lot of these older men, not only do they have some erectile dysfunction, but they also have BPH. And so you're killing two birds at one stone. But again, to overcome this problem, again, by giving it to them daily, you're increasing the blood flow to the penis, keeping the tissue healthy. Men get regular erections, they're getting those nighttime erections again. And so after a while, a lot of men don't really need this because you got the tissue healthy again. Cialis has also been approved for the use of pulmonary hypertension or high blood pressure over the lungs, which a lot of cardiac patients also have, so it makes their breathing a lot easier. What's nice also about Cialis is generic, 90-day supply using GoodRx. A lot of men are able to obtain a 90-day supply for less than $20. So a lot of studies have looked at the daily use of Cialis, showing significant improvement in endothelial function, not just of the penis, but of the whole body. The endothelium is the innermost lining of your arteries. The more healthy that endothelium is, less apt that you're right to have strokes and heart attacks. It's also been shown to lower markers of inflammation, such as IL-6 and C-reactive protein, as well as slow-mediated vasodilation of the brachial artery. Daily Cialis also makes testosterone more available to testosterone binding sites. One thing that is inevitable as we age is the refractory time between erections. We all know we have to think back when we're in our 20s and we can get 20 erections a day. The increase in refractory time as we age is thought to be due to increased prolactin as we age. One study showed that the use of vitamin B6 lowers the prolactin, which in turn lowers the refractory time. So in summary, the impact of lifestyle, sexual health in men is like most things. It's a combination of lifestyle and genetics. I just had a guy the other day come in, he's 85 years old. He's been married for 45 years. Him and his wife have a schedule of every other day having unassisted sex. Yeah, he doesn't take Viagra. It just, again, you always think back to some of it had to be genetics, but some of it has to be the fact that he's using it. But I also have men that come in their 30s and they're at poor metabolic health and they had erectile dysfunction. And to me personally, I would think this would be one of my top 3 motivators to get myself in shape. Just this morning, I had a 50-year-old male sent to me initially for having hypertension. And the etiology of his uncontrolled hypertension was that he was of poor metabolic health. With the aid of some medications, lifestyle changes, and some supplements, we were able to get his marker of diabetes, known as the hemoglobin A1C, down from 9 to 5.6 in a 9-month period of time. His triglycerides from 356 down to 90, and his waist circumference from 46 down to 36. It was sort of cute. At the end of our visit today, I offered to renew his prescription of Cialis. He jumps down from the table, gives me a big smile, and pats me on the back and goes, "I don't need it anymore." Walked out. It was pretty rewarding. There's a strong link between cardiovascular health and sexual health. Sexual health, like cardiovascular health, is based on the 4 pillars: diet, exercise, sleep, and stress management. Reduction in insulin resistance, obesity, smoking cessation, improvement in sleep quality, exercise, and diet are needed to improve our sexual health. ED is known as a canary in the coal mine as far as our cardiovascular health. And many of the cardiologists that I work with use erectile dysfunction as an indicator for screening from cardiovascular disease. Several studies have shown that the odds from the onset of ED, an increase of 20 to 25% incidence of heart attacks or strokes within 7 years. Montessori reported 50% of men who had a cardiovascular event reported ED 39 months prior to that. And because I'm from the cardiovascular world, I'm going to go down a couple of little rabbit holes. We'll talk a little bit right now about blood pressure. Blood pressure is often overlooked, and it's not an exaggeration that aggressively managing your blood pressure is a key factor for a longer and healthier life. We all know smoking is bad for us. Well, smoking is a chemical irritant to the lining of your blood vessels. Having high blood pressure acts as a mechanical irritant. To me, it is just as important as a risk factor as smoking for the development of cardiovascular disease. Lifestyle factors have a profound impact on everyone, and everyone has the power to take steps towards controlling and improving one's blood pressure. I'm often told that, Doc, I'm just taking too many medications. And it depends what kind of mood I'm in that day, but sometimes I'm a bit of a smart ass, and I'll look at him in the eyes and say, look, it's not the fact that you're medication deficient. High blood pressure generally has no symptoms, and that's why we call it a silent killer. It is a risk factor for heart attack, stroke, dementia, and renal failure. It's sad, but 1/2 of adult population in the United States has hypertension. Hypertension is defined as having a blood pressure, systolic pressure greater than 130, or diastolic pressure greater than 80. Only 1 in 4 Americans have their blood pressure under control. The landmark SPRINT study found that bringing the blood pressure to less than 120/80 resulted in a huge reduction in the risk of heart attacks, strokes, kidney failure, and dementia. A yearly visit to your doctor can give you a rough estimate of what your blood pressure is. But your blood pressure is subject to change depending on your hydration status, how much alcohol you drink, your sodium intake, your stress level, your caffeine intake, deprivation of sleep, and many other variables. To be more precise, blood pressure requires multiple measures during the course of the day, and that's why once a year I ask my patients to take their blood pressure twice a day for 1 week, and then bring those results either to me or their primary care doc. The gold standard for measurement of blood pressure is a cuff and a stethoscope. This is sort of awkward, and there's a learning curve involved. Automated cuffs can often overestimate our blood pressure because they're based on an algorithm, but they offer a close proximity to one's blood pressure. 2 models of blood pressure kits that I recommend are the Worthing and the Omron. Accuracy matters. When taking one blood pressure at home, make sure that you're sitting, you have your back supported, make sure that the cuff is touching your skin. You don't want it too tight or too loose. You want the cuff to be about 1 inch above your elbow crease. You want to be at rest for at least 5 minutes. You don't want to be talking. You want to try to be as calm as possible. And then hit the button. Having a full bladder will raise your blood pressure 10 to 15 points. Quick word about the production of nitric oxide. Cialis, Viagra, and similar agents depend on the health of the individual and your body's ability to produce nitric oxide. And that's why these agents don't work for everyone. These products slow the breakdown of nitric oxide. Nitric oxide is a gas produced by the lining of your vessel, and it has a very short half-life. Measures to increase your nitric oxide. Again, nitric oxide production is based on your overall body health. And as we talked about before, the 4 pillars are diet, exercise, sleep, and stress management. Believe it or not, the first step in production of nitric oxide is in our mouth. Several books have likely come out recently about the importance of nitric oxide and the importance of breathing through our nose rather than our mouth. So quick tips about increasing nitric oxide. By breathing through your nose and not your mouth, you preserve the microbiome of your nose and your mouth. Our mouth has good bacteria and it has bad bacteria. And it's that good bacteria that produces the first step of the nitric oxide production. Some things that we use on a daily basis, like fluoride in our water, the fluoride in our toothpaste, the fluoride in our mouthwash, will kill not only the good bacteria, but the bad bacteria. So elimination of fluoride is one step in your body's production of more nitric oxide. One of the things that is common on the internet nowadays is the use of mouth tape. Has anybody tried using mouth tape? No one? No one's seen the internet about people using mouth tape? A lot of athletes are using mouth tape right now as a way of increasing their functional capacity. What's that?
Eric's mic.
Yeah. So by taping your mouth shut at night, you sort of locking your tongue in place. One of the causes of sleep apnea is the tongue will roll back into your airway, causing the snoring or causing the absence of breath by totally occluding your mouth. So taping it also increases resistance of your breath, which another reason why people develop sleep apnea is the trachea may close up or partially occlude. By increasing the resistance and keeping the trachea open. Now, I'm not saying that using mouth tape is a cure for sleep apnea, but it does aid in production of nitric oxide, and it is a step in the right direction. A lot of times we can't get patients to wear the CPAP or the BiPAP. 6 reasons to breathe through your nose. Number 1, improves your nasal microbiome. So this helps you prevent infections. 2, increases nitric oxide. And by increasing nitric oxide, it's going to improve your lung function. It's going to decrease pulmonary vascular resistance, which is going to make it easier for you to breathe. And lastly, it's going to increase your oxygen uptake. Number 3, by breathing through your nose rather than your mouth, you can humidify the air that you're breathing in. So this time of the year, we start turning on the furnace, we start breathing in the dry air. Everybody's complaining about their nasal membranes. 4, it filters out air pollutants and dust and particles. 5, it improves the microbiome of your mouth. The mouth breathers generally have more cavities. Just talk to any dentist. And 6, there's a cosmetic reason. By breathing through your nose, you're preserving your jawline, and thus by preserving your jawline, overall you're going to have less wrinkles. So new therapies that have promise for the treatment of erectile dysfunction. One is called Gainswave. It's a company that uses shockwave therapy. Shockwaves induce microtrauma that stimulate angiogenesis. By stimulating angiogenesis, you're stimulating the production of stem cells. The procedure delivers 2,500 shots in 6 different areas of the penis. It takes between 25 to 30 minutes. You come in once or twice a week for 3 to 6 weeks. Believe it or not, it's not painful. It's well tolerated. It's actually a class 3 medical device. It doesn't work for everyone, but research shows that it does show promise. There is an ongoing study right now that is looking at Gainswave therapy in conjunction with stem cells, and the initial outcome looks very promising. There's also clinics that use something called radio shock, and these are popping up all over the place. They're 100 times less as far as pressure than the gains weight technology. It's more like a pneumatic device. There's no research behind this, and anyone can purchase this. So you can go to 7-Eleven, get your ED treatment, and then get your big pop at the same time. The problem with the ED population, you can go to you can go to the drugstores and you see all these products out there. And the problem with the ED population is that they're desperate and they're also very vulnerable. They want treatment, and usually it helps embarrassed to seek help. The other problem is that the ED population has a very high placebo response rate. Give 100 men a sugar pill and tell them that they're going to have the best erections of their life. 30% of them will have the best erections of their life. It's the truth. Let's talk now about the interplay of sex hormones, the impact of low testosterone, and considerations for testosterone replacement therapy. You guys comfortable? So a quick little physiology lesson. There's pulsatile secretions of gonadotropin from the hypothalamus that goes to the pituitary. The pituitary in turn secretes two hormones, LH and FSH. LH and FSH go to the testicles where Leydig cells produce testosterone, and so the Sertoli cells produce sperm. LH stimulates the Leydig cells, producing testosterone, while FSH stimulates the Sertoli cells, producing the sperm. Testosterone can be broken down. Testosterone is bound by the body by albumin, and it's also bound by the body by sex-binding hormone. 0.3% of testosterone goes into the production of estrogen, and 6.6 to 8% of testosterone goes to DHT. It is the free testosterone that is bioavailable to the body. So total testosterone is really just there. It's really, you really want to know what a guy's free testosterone is, and it's the free testosterone is going to dictate whether that guy feels good or not. Many clinics try to block estrogen production by using aromatase inhibitors. And this is generally not a good idea because blocking estrogen, you're going to decrease somebody's libido, and you can also cause erectile dysfunction. What should be measured when you go to your doctor is FSH, LH, testosterone, free testosterone, vitamin D, and sex-binding hormone. Again, the body only cares about free testosterone. This is the best correlation for a man's symptoms. For example, if a guy walks in and his testosterone is 500, but he feels lousy, checking his sex-binding hormone will tell you everything. If his sex-binding hormone is high, his testosterone is still high, it's going to count for his symptoms. But if a guy comes in and his testosterone is a little bit on the low side, like say 300, and his sex-binding hormone is low, he may feel like $1 million. One misconception about testosterone is we think that testosterone should go down as we age. That's not true. A man can maintain his testosterone by avoiding gaining comorbid conditions. It's the comorbid conditions that lower a man's testosterone. One thing that does go up as we age is sex-binding hormone. So what are the symptoms of low testosterone? Low energy, low libido, erectile dysfunction, increased fat disposition, decreased muscle mass, depression, poor sleep, poor bone health, history of fractures, and metabolic syndrome. So, some methods for increasing endogenous testosterone, or our ability to produce testosterone on our own. Again, lifestyle plays a huge role. Cholesterol is a building block of testosterone. So by eating enough healthy fats like fatty fishes, avocados, nuts and seeds, etc., you can boost your ability to produce testosterone. Testosterone is mainly made while we sleep. All the signs of low testosterone correlate to someone having sleep apnea. So if you do think that you have sleep apnea, you can go online. There's something called the Stop Bang test, and you can take that test. And if you score high in that test, that's something to discuss with your primary care doctor. Exercise. Many studies have shown significant increases in testosterone by resistance exercise. Adding lean body mass, working the large muscles of our body, our butt, our legs, and our back, can increase one's testosterone. High-intensity exercise over prolonged periods of time will lower a man's testosterone levels. With the onset of COVID, the use of supplements has gone crazy. The use of supplements have gone up about 200%. The supplement industry lacks food and drug oversight. There was a recent study that just came out in JAMA by Dr. Cohen, and he looked at the supplement melatonin, very common sleep aid, and he looked at 25 different manufacturers of melatonin. And what he found was that the 88% of these products were mislabeled. One product in particular contained no melatonin and 33 grams of CBD. Another product that was labeled melatonin, 10 milligrams, actually had 347% more than what was advertised. Only 3 of the products that were tested out of the 25 were within 10% of what was advertised. Supplements need to be looked at like medications. Each one of these supplements have certain pharmacodynamics and pharmacokinetics, just like the medicines that we are prescribed. Make sure that your supplements are third-party tested. You may pay a little bit more, but at least you're going to get what you're paid for.
A lot of times they'll say pharmaceutical grade on the bottles too.
Yeah, but
They've been actually tested by a medical.
Right. I mean, that's what you want to look. You want to look that it was third-party tested.
Yeah.
I mean, if it doesn't say that on the bottle, I would avoid that product. I mean, the 3 companies that I like to buy supplements for, because I know that they're third-party tested, is Jarrow, Pure Encapsulations, and Thorne. Those are very dependable companies, and those are the ones that I recommend for my patients. Yeah. I mean, you're going to pay a little bit more from those companies, but again, you know you're going to get that product. So some little simple things that we can look at to optimize your testosterone. One is making sure that your vitamin D level is adequate. I've talked a little bit in the past about the importance of vitamin D and how it impacts our hormones. So you want to get your vitamin D tested, your vitamin D level tested, and you want to make sure that your vitamin D is between 40 and 60, especially going into the winter, because vitamin D is also essential for our immune health. One supplement that I haven't talked about in the past that I'm really high on is creatine. Creatine has multiple beneficial effects. Probably the most well-studied supplement that's out there. it's safe, and the other thing is it's pretty cheap. You can get a jug for around $15. Creatine helps with oxidative stress. It's a backup fuel tank for your mitochondria. It holds that backup ATP. So what I notice when I take creatine and I'm working out, it's that difference between me getting that fifth, sixth, seventh, or eighth rep up when I'm finishing, my exercise. Creatine also increases total testosterone. It also increases the conversion of testosterone to DHT. It's also been shown to improve brain health. There's several studies out there showing creatine increases cognition, especially in the elderly. Creatine's also been known to lower homocysteine. Homocysteine is a risk factor for the development of cardiovascular disease and also a risk factor for the development of Alzheimer's disease. So lowering this will lower your risk of cardiovascular disease and Alzheimer's disease. The use of boron. As I stated before, as we age, total testosterone should stay the same, and what does happen for us is that sex-binding hormones will increase. Boron will lower your sex-binding hormone. Taking 5 to 12 milligrams a day is the recommended dose. Boron is also very depleted in American soils, so it's very difficult for us to get enough boron from the foods that we eat. Remember, having high levels of sex-binding hormones will reduce free testosterone, or how much testosterone is bioavailable. Free testosterone should be 2 to 4% of total testosterone. A couple other supplements that you can look into that help with the production of testosterone if you're looking at boosting endogenous testosterone or testosterone in your body weights. One supplement is called Tongkat-Eli or Lomjak. Tongkat-Eli upregulates several different enzymes in the steroid genesis cascade. It helps in many key steps in the synthesis of testosterone. Recommended is 300 to 1200 milligrams a day. In most, you will notice an increase in free testosterone and a slight increase in luteinizing hormone. For the higher your SBG, the more that Lomjak will help lower this. Another supplement to be looked at is something called Fidosia agrestis. This will increase your luteinizing hormone. It stimulates the pituitary to release more luteinizing hormone, thus stimulating cells to produce more testosterone. Recommended dose is either 300 milligrams a day or 600 milligrams Monday, Wednesday, and Friday. On the internet, you hear a lot about Clomid or Clomiphene. Clomiphene, women may hear of this as it's used as a fertility drug. But for men, it's taken 3 times a week. It preserves testosterone volume and spermatic function, and it works as a negative feedback to estrogen receptors. Patients get a nice increase in free testosterone in a stroke. The problem is by blocking estrogen, is 40% of men taking clomiphene will get no erections and have reduced libido. So I'm not really high on this. And there's a cousin of it that you read about is called enclomiphene. Again, I'm not a big fan. I'm not a big fan of blocking someone's estrogen. And the other thing from a cardiovascular standpoint, clomiphene has been shown to boost somebody's testosterone level. Testosterone is a precursor to cholesterol, so you've got that issue to deal with. So let's talk about the types of testosterone replacement therapies. They're pellets, topicals, injectables, intranasal, and oral. One product that I've used several times on some patients is the intranasal preparation. It's called the Testo. It's intranasal. You use it 3 times a day. It's 11 milligrams 3 times a day, or 30 milligrams daily. This form also has the advantage of not suppressing the ability to produce sperm or fertility. It has the fastest onset of action. It's readily bound to testosterone receptors. Because you're taking small doses more frequently, it's more physiological. People feel really good taking it. I have a buddy that uses it, and he swears by it, and he uses it before his workouts or before he has sex. So far, it looks like it has a lot less side effects than some of the other preparations of testosterone, but of course it's newer, so more research needs to be out there. The most common form is injectable. It's the most common, it's cheap, it's roughly about $25 a month. It can be injected either intramuscularly or subcutaneously. You start off with 50 milligrams twice a week, Sundays and Thursdays. My preference is subcutaneous, using a very small gauge needle, 25 gauge needle, 5/8 of an inch, 1 cc syringe. You just pinch the fat. By pinching the fat, it slows the absorption of the testosterone. Also, by pinching the fat, the patients say that they have a lot less pain. By injecting into the fat, overall, you get a higher concentration of testosterone for a longer period of time. The injectable comes in two types of preparation. One is cypionate. You use that for younger patients, and methionate. We use those for patients over 60, and you get less swelling this way. One of the new products that's out there is Ziacid, which is a pre-loaded syringe. Comes with a 27 gauge needle, so very fine needle. Comes in the methionate. This is a little bit more expensive. You get four months for about $150. One of the newer forms of testosterone replacement is out there is the oral preparation. It was finally approved in 2019. Historically, giving somebody oral preparation harmful to the liver. This preparation bypasses the liver. It gets absorbed by the lymphatic system. You take it twice a day. You need to take it with a fatty meal. If you don't take it with the meal, there's zero absorption. And then lastly, pellets. Pellets have the advantage of getting a steady increase of one's testosterone. You go someplace every 3 to 4 months. Can't work out for 72 hours after the pellets are inserted. Some patients say that it's a little bit painful, but it's usually very well tolerated. And then topicals. Topicals, I tend to stay away from. Very poorly absorbed, unpredictable absorption, and not recommended. How we should think about testosterone. Testosterone has numerous effects on different body parts at different levels. We define low testosterone as a testosterone level less than 300 nanograms per deciliter. In general, men will lose erections and lose muscle mass and bone density by having the testosterone less than 200. So I'm often asked by my patients what they should use for the treatment of BPH, or benign prostatic hyperplasia. And what I recommend is Cialis 5 milligrams daily. Patients would tell me that they'll have relief of their symptoms within 2 weeks. And then if an alpha blocker needs to be added, the use of alfluzin. Alfluzin is an alpha blocker. that has less side effects of having orthostatic hypotension. Orthostatic hypotension is when people stand up, their blood pressure decreases. Another side effect from alpha blockers is something called retrograde ejaculation, or the ejaculate will go backwards into the bladder instead of going forward. And Alfluza has less side effects from this. One thing that I've seen a couple times since I've been here is something called post-finasteride syndrome. Finasteride is often used for the treatment of BPH. It's a very common drug. 5-alpha reductase is located throughout the body, and blocking this has many downstream effects. Remarkably, stopping finasteride, you still can have side effects 2 years later. The incidence of post-finasteride syndrome is 5 to 7%. It's characterized by erectile dysfunction, impotence, fatigue, depression, and loss of cognitive abilities. What scares me about this drug is that now you can buy it over the counter and rub it into your scalp for hair loss. And so a lot of these young kids are using this. And I don't know, there's a certain amount of this drug that's getting absorbed, and it's sort of scary. These drugs block the conversion of testosterone to DHT, but they also have downstream effects in the fact that they block the development of progesterone and aldosterone. It blocks progesterone from being something called L-prednisone. This is important because this compound can lead to fatigue, depression, high anxiety, and difficulty in cognition. The suicide rate in people with post-finasteride syndrome is 5 to 7%. That might seem low, but if you look at the total scripts written for finasteride for the use of hair loss or the use for treatment of BPH, it's phenomenal. Any drug to me that offers a higher rate of suicide is a drug to sit up and take notice about. Again, this drug is unique in the fact that if the patient does experience side effects, many of these patients still have side effects 2 years after this. So the question I get asked a lot is testosterone replacement safe? So one of the common thoughts is that testosterone replacement causes prostate cancer. And it's remarkable in that this rumor started in 1941, and it started by a guy by the name of Huggins, and he based it off the results of one single patient. 2018, the American Urological Association came out with the testosterone guidelines stating, quote, "There is no association between testosterone and prostate cancer." In fact, review of the literature suggests that having low testosterone may be increasing the incidence of prostate cancer. So how about heart disease? Does testosterone cause heart disease? Because we've heard this before. So there was one study that came out about 5 years ago, and it looked at over 5,000 people. And they studied these people over a 10-year period of time. And what it shown was there was a slight 1 to 2% increase in cardiovascular incidence at 1 year. But at 10 years, it actually showed a 20% reduction in cardiovascular benefit. It showed a reduction of 20% reduction in cardiovascular events at 10 years. More recently, that came out this summer, was a study called the Traverse study. And this study was published by Dr. Michael Lukoff of the Cleveland Clinic. And it was a multi-center study. And again, they looked at about 5,000 people. And they looked at it for a 5-year period of time. And what was unique about this study is they actually looked at high-risk individuals. So people that had previous strokes, heart attacks, people that had high cholesterol, hypertension. So they had multiple risk factors for developing cardiovascular disease. And they found no increase in cardiovascular events in people taking testosterone. There was a slight increase, 1 to 2% increase in clotting, and people that develop clots in their legs, clots in their lungs, and people taking testosterone. And this makes sense in the fact that what testosterone does is it increases something called thromboxane A2. Thromboxane A2 is found on the platelet. And platelet, again, are things that form clots in our body. And by increasing thromboxane A2, you're increasing the platelet's ability to form a clot. So I tell my patients that are taking testosterone replacement to make sure that they're taking at least 4 aspirin per week to lower that risk. So the truth of the matter is there's been a paradigm shift over the last several years that testosterone may actually be protective against prostate cancer. Testosterone replacement needs monitoring though. I bring my patients in twice a year for labs such as vitamin D, blood counts, their PSA, testosterone free and total, their sex-binding hormone, FSH, and LH.